And welcome to another Mark Bishop Show. Northwestern Memorial Hospital in Chicago has always been on the cutting edge of technology. In 2018, the Northwestern Medicine Bluhm Cardiovascular Institute launched a first-of-its-kind center to investigate the role of artificial intelligence and machine learning in the treatment of heart disease. Now, my special guest for the show is Dr. Jim Thomas, who is the director for the Center for Heart Valve Disease and Academic Affairs in the Bluhm Cardiovascular Institute at Northwestern Medicine. Welcome, Doc.
Nice to be with you.
Cardiovascular disease, it still remains the number one killer of Americans, and the goal is to achieve earlier detection, which will lead to better management and outcomes. So, what is artificial intelligence and machine learning?
Artificial intelligence is sort of a broad category of computer programs that mimic the human mind. And machine learning is how you train that artificial intelligence algorithm to get so smart. And it's something, the concepts have been around for 70 years. People were talking about this back in the 50s. But computers were just so primitive at the time that you couldn't possibly really do anything with the algorithms they were trying to develop back then. It's only in the last 10 years that the rise of these graphics processing units and super fast computers have allowed us to do the sort of deep learning mining that allows us to do sophisticated artificial intelligence programming and really bring this into the mainstream.
Well, Dr. Thomas, how can patients and their doctors benefit from it?
Well, let's take an example of something that every doctor has, a stethoscope. It's been around for 200 years, and it hasn't changed much in 200 years. It's still a bell on the chest and two tubes into the ears. To be honest, people were pretty good at it 40, 50 years ago. More recently, not so much, because there are so many other things you have to learn in medicine that the expertise of listening to hearts is not what it used to be. So we've been working with a company that first amplifies the heart sound so it's easier to hear, and then can send that sound wave up to the cloud. We're an AI algorithm that's been trained on thousands and thousands of stethoscope recordings that were labeled by experts and proven to be, what they were by looking at an echocardiogram as the definitive diagnosis. It will come down and tell you if there's a murmur or not and what that murmur eventually is likely to be. And we can now detect severe aortic stenosis about 90% of the time in patients that might be missed in a busy emergency room or just in a place where there may not be the expertise to really make this diagnosis.
Yeah, well, as you say, the basic stethoscope, 200 years when you think about it. But apparently this artificial intelligence platform, obviously, could be more reliable and low-cost way to identify patients with heart disease. I was reading in the research
That's
something
right.
like, 93% of patients with severe aortic stenosis it could do. So pretty good. Now, tell me why. Why did Northwestern Medicine, Bluhm Cardiovascular Institute, choose to invest in an AI program?
Well, that's an interesting story because I started working in AI. I came to Northwestern 7 years ago, and I started working with a company in the echo field, echocardiography. And in some of the work I was doing, I was speaking to Pat McCarthy, our director of the Bluhm Cardiovascular Institute. Now, Pat is a very well-known and outstanding heart surgeon, but would never be mistaken for a computer engineer. But he recognized that AI was sort of the next big thing. And he approached Mr. Neil Bluhm, our benefactor of the Bluhm Cardiovascular Institute, who agreed with this. And we founded this about 3 years ago. And one big initiative that came out of this was forming a fellowship where trainees in cardiology and cardiac surgery could really learn the deep in the trenches techniques of artificial intelligence and machine learning. And so these students take a full year up at the Evanston campus with our computer science colleagues, and they come back, still as smart as ever in cardiology, but able to do the real computer programming and training these algorithms. And we expect them to be the leaders of tomorrow.
Well, speaking of tomorrow, does this mean robots will be providing my healthcare in the future?
Everyone's afraid of the robots. No, I think the key is if you look at our the website for our overall medicine approach to AI, the AI is an artificial intelligence. It's augmented intelligence. The idea is that the human with the computer is always going to be more accurate than either one alone. You can go back as far as just the chess world, where computers have been better than the best grandmaster for 25 years. Mm-hmm. But still, if you take a reasonable chess player with a computer algorithm, they will do better than the best computer out there. So it's been proven in mammography, in looking at CT scans, in looking at echocardiograms. It's better when you pair the human with the algorithm or with the robotics. Robotics may make your movement smoother and more precise, but you still want to have the surgeon ultimately guiding what's going on there.
Right. Well, not so far back, in 2019, Northwestern Memorial Hospital led a clinical trial to validate this new artificial intelligence guided ultrasound system, which does enable healthcare providers with ultrasound expertise, of course, to acquire quality ultrasound images of the human heart with automatic assessment of the pumping function. I mean, we've been waiting, and you have in your industry, in your career, been seeing changes over a period of time. But did you ever think we'd get to this level or even further? Can you see down the road a little where we could go?
Yeah, I tell you, the whole AI and echo world has moved much faster than I ever thought. The trial you referred to, which we recently published in JAMA Cardiology, is really a bit like GPS for your car. It will take someone who's a complete stranger to ultrasound, a nurse or even a medical assistant. We've trained on these, and with just a little bit of orientation, it will give you turn-by-turn instructions that allows you to get very precise, interpretable ultrasound images. So I think as this again has the possibility of democratizing medicine greatly by putting expertise out into places where it just doesn't exist now, whether that's rural areas of the United States, the inner city, the developing world, even at Northwestern into our COVID ward. Mm-hmm. We put one of these machines and could have the frontline providers get echocardiograms when they needed a quick look at how the heart was pumping, mm-hmm. and our sonographers didn't have to gown up and go into the hot zone to do this. So looking down the road, I think there's just going to be an acceleration of all of this work. I think three-dimensional imaging of the heart has made major advances. If you can combine three-dimensional imaging with artificial intelligence, that could in a very automated, rapid fashion, allow you to gather sort of all the data you need out of an echocardiogram and do some very sophisticated analysis, but still overseen by a clinician at the end of the day.
Right, but helping to go forward. Amazing stuff, fascinating. And is any of this at all on the interesting folks? You can go to this in your pajamas if you like, but www.nm.org/radio. Now, that's the site for you to be able to go to. artificial intelligence. It's helping cardiologists diagnose heart disease. Artificial intelligence, guided ultrasounds, stethoscopes, and patient wearables. Look, all better management. Fascinating stuff. So, doctor, is this on the site that people can read about?
If probably the best way to find a lot of this is if you go in and put Institute for Augmented Intelligence in Medicine at Northwestern. That'll take you right to the overall medicine augmented intelligence website. You can see all the exciting stuff going on in pathology and cardiology and radiology. It's sort of getting its tentacles into everything now.
All right. What was that again quickly? Institute for Augmented
Intelligence in Medicine at Northwestern. If you put Northwestern AI Medicine, I'll bet you'll get to it.
Okay. Northwestern.
Because you know the Google machine is pretty good these days.
All right. Fantastic, because I want to put it up on my site and keep it there for you. Listen, we've got to go, but fascinating stuff. Good job. Well done. Dr. James, or Jim Thomas, he's the director for the Center for Heart Valve Disease and Academic Affairs in the Bluhm Cardiovascular Institute at Northwestern Medicine. Thank you, doctor. Have a great day.
It's been a pleasure speaking to you, Mark, and greetings to all your listeners.
Goodbye now.
Bye now.